wanting to serve in rural counties, a little bit more rural places. We have quite a presence in Colorado Springs and in Teller County. We're growing to Park County, Fremont County, Pueblo County, Crowley, and Otero. So those are the areas that we're really growing in. And so a little bit about our agency. We are a home care agency, as I said. We're an IHSS agency. We have a license for Part B, which means that we do not provide nursing care. We provide non-medical care. So we have...
Hold it. You don't do nursing, but you provide medical care?
Non-medical. Non-medical, meaning homemaker and personal care services. So some people who want to stay in their homes don't need medical care, or they only need medical care to come in and out once in a while. But they need some daily care to help them with medications, with transfers, with bathing, moving them here and there in the house, ensuring that they're safe and that their needs are met. And so we provide that level of care, but we do not provide full nursing care. And so many people who want to stay in their homes, we call it staying in place, need the help so that they can stay where they are and they don't have to move into nursing homes. And that's what we want to provide. So David is the supervisor of home care for our agency, and he's the one that goes into the homes and does the evaluations to determine what the individual consumer's needs are. Most of our caregivers, the people who provide care, are family, and they're paid through Medicaid. And so the wonderful thing is that we can pay family members to provide care, or friends. So each of you might know people who are your neighbors or your friends, if you got ill, might be willing to help out, but it'd be really great if they got something financial as well to support them, because they won't necessarily be working outside of the home at the same time, right?
How much are we talking about?
It depends on the type of care that's provided, so there's different levels of care where people get paid a different amount.
What's the range?
The range is about $11.10
to $11.90.
to $11.90. We also provide benefits, health benefits for the caregiver once they hit 30 hours. And so we have health benefits and a 401k plan. So if someone is not working outside the home and they're helping in the home, they can get their own medical benefits paid, at least in part. And that makes a big difference. The other thing for you to know about Envida is we're a nonprofit. Most home care agencies in today's world are for-profits. I think how we differ from a lot of home care agencies is we really come at this from a place of a lot of compassion and understanding. So I want to tell you a little bit about my story, because I think it's important to know that I had parents who were aging. My mother became very ill after a number of strokes and falls and ended up in a nursing home. I couldn't care for her even though she lived in my hometown, Colorado Springs, because she had to have insulin many times a day. She had to be lifted, and she was a larger person than I am, and I have a very bad back. And I was working full-time. This is before you could pay someone, family, to give care. I couldn't give up my job because I couldn't survive.